Welcome back. It's time to Ask the Vet, where we try to get some of your questions answered that you may have about caring for your family pet. Joining us today is Dr. Stacy Mozashek from the Firehouse Animal Health Center here in Austin. Thank you for being here.
Thanks for having us.
Who did you bring today?
This is Levi.
Levi.
He's a little 8-year-old dachshund.
And beautiful spotting. What do you call this again?
Dapple.
Dapple?
Dapple. Mm-hmm.
Dapple dachshund. About 8 years old, you said?
Yep. And he's a sweet little guy. He's had some back issues, as all dachshunds do, but he's through it, and he's back to his normal self, running and playing, doing dachshund things.
And today we're talking a little bit about dental care and what you should do to care for your dog's or cat's teeth. What advice do you have out there?
Well, a lot of people ask about toothbrushing, and is this something I really have to do for my pet? And my answer is always yes.
Really?
The veterinary dentist will tell you, if you can do it at least 4 times a week, you're really going to prevent that plaque from leading to further tartar buildup on the teeth, and hopefully prevent a anesthetic procedure. A true dental cleaning requires anesthesia in our pet. So toothbrushing at home, if you have the time for it and the pet will tolerate it, is really great preventative medicine. Starting when they're young, cats and dogs, and they get used to it. Maybe put that, give the kids a job and they can start brushing the teeth. And
sometimes it can be difficult. They don't always respond that well to the toothbrush.
Sure. I mean, there's always going to be that pet that won't tolerate it, for one, or that your schedule just does not afford that kind of time to do it that frequently. And that's understandable. And so people are always asking, well, if I can't brush the teeth, what's the next best thing I can do? Because really, people want to keep their dog's mouth healthy. An unhealthy mouth is always stinky, and so that's always another concern. So other things that I think are good home preventative measures for the teeth are like dog chews, dental chews. Dental treats and water additives that really help the plaque formation. And then there's prescription dental diets that are actually the matrix of the kibble helps prevent plaque and tartar buildup. And I always refer people to the Veterinary Oral Health Council's website. They have a list of actually approved products that have some validity to their claims. So there's a lot of people or a lot of products out there that claim to do things for dental health, but the best resource is looking on that website to make sure that there's some research behind the claims that the products are providing.
And now as humans, we brush our teeth twice a day. How often should we brush their teeth?
Well, twice a day would be great. Whoever has time for that, I applaud them. But ideally, that would be a great preventive measure. But again, going back to that minimum of 4 days a week is great. But even on top of that, people don't understand that even with brushing and good dental care, pets are probably still going to need a general anesthetic dental prophy at some point in their life, just like us. We brush our teeth twice a day. Our dentist still recommends a professional cleaning every 6 months, so they can get under the gum line, really scale and polish things that you can't do at home. So unfortunately, for most pets, a general anesthetic procedure with dental cleaning is going to be in their future at some point. But either delaying that procedure or putting bigger gaps in between those procedures, time gaps, with good dental care at home is really a good thing to do.
And when you talk about teeth cleaning, you mentioned the anesthetic. The age of the pet, does that come into play at all?
Yeah, and that's a big concern for pet owners because a lot of times these pets are older pets, they're having dental disease, and the concern is, I really don't want to put my pet under general anesthesia. And certainly I understand that concern, but we take a lot of precautions with our pets and good physical exam, make sure there's not any underlying heart issue, doing some pre-anesthetic blood work, making sure the liver and kidneys are functioning, all that stuff. So a good pre-anesthetic workup your veterinarian would recommend. And then from there, if everything else looks good, age is really not a disease. So if everything looks good on exam and blood work, those pets do just fine.
Should be fine.
And they're probably the ones that need it the most. And a lot of times, we hear this all the time that the pet wasn't acting painful before, but they get the teeth clean, they get some infected teeth out of the mouth, and the pet's acting younger.
Yeah, may renewed energy.
Absolutely. We hear that all the time. So I firmly believe that good dental health makes a pet feel better too.
Dr. Stacy Mozashek from the Firehouse Animal Health Center, and Levi, thank you so much for being here. Once again, we want to remind you, if you have questions that you'd like to see answered on our Ask the Vet segment, send your questions to askthevet@kxan.com. Thank you guys both for being here.
Thanks for having us.
All right, we'll be right back.